You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. Thank you for joining me and listening. This is the Dental Zone podcast. This is where I talk about all things holistic dentistry, health and well-being. If you want to find out more, you can jump on over to holisticdentistry.au. But for now, let's get in the zone. I'm very passionate about what I do. I care about people. I care about their health and well-being. And it's my belief that if you want to have a healthy life, you need to have a healthy body and a healthy mouth, because I think you can't be healthy without healthy teeth and gums. And that's what I'm going to be talking about today. We have a saying here at my dental practice, Evolve Dental Healing in Brisbane, that whilst your eyes may be the window to the soul, the mouth is the doorway to disease. So what does that mean? In essence, what I'm saying is that if your mouth is unhealthy, has untreated disease, inflammation or infection, then it's increasing your risk for ill health and it's already making you sick. Now, a lot of people don't realise that when they've got red, bleeding or swollen gums, that this is gum disease. And gum disease allows harmful bacteria to spread from your mouth to the rest of your body. Now, gum disease means your gums are inflamed and they're infected. And this means that the blood that's flowing through your gums also flows through your whole body. So that means if you have inflammation in your mouth, you essentially have it everywhere. Now, inflammation is the trigger to many of our chronic and life-threatening health conditions like heart disease, strokes, high blood pressure, dementia, and even types of cancers. Now, for me as a dentist, and particularly as a holistic dentist, I have the unique opportunity of looking inside your mouth and being able to see the condition of what's going on in your body. I say to my patients that your gums are a little bit like the canary in the cage. If your gums aren't healthy, it's telling me there's something going on with the body, that there's something not quite right. Yes, we know we have to brush and floss, don't eat too much sugar, remove the plaque bacteria that build up so that our gums can be healthy. But if your gums aren't healthy, your body won't be healthy either. So I get to look for the signs of gum disease, but I also look for the warning signs of inflammation and other diseases that can be contributing to or setting you up for chronic systemic health issues. I can look at your mouth and know if you're unhealthy, and even if you have some systemic health conditions. The window, the mouth, as I've said before, is the window into the health of the body. It can show signs of things like nutritional deficiencies or general infection. Systemic diseases, those that infect the entire body, such as diabetes, blood cancers, and more, can be detected by looking at the health of the mouth due to the presence of lesions or other problems that we can see, like bleeding and swollen gums, and gums that don't heal when we're doing treatment. Now, I've lost count of the number of patients I've seen where their mouth has triggered health alarm bells for me. And after blood tests and seeking medical care, they were diagnosed as diabetic, pre-diabetic, anemic, lacking in nutrients, having hormonal imbalances, and sadly, in a few cases, we have detected leukemia. Now, your mouth isn't this clean, sterile area. It is filled with countless bacteria, and that's why as dentists we have to wear gloves and masks and safety glasses, and we have to sterilise all our equipment. Otherwise, that bacteria and the viruses and other things that are in your body can be spread from one patient to another. But those bacteria that can be linked to tooth decay and gum disease are responsible for bad breath. They are also being spread from your mouth to other parts of your body. And in your mouth, there's this ecosystem, what they call the microbiome, the same as in your gut, that has to be in balance. So you've got to have the balance of the healthy bacteria to keep the bad bacteria and those nasty bacteria under control. Now, if things are out of balance through diet, lack of nutrition, stress, acidity in the body, and your gut bacteria being knocked out through antibiotics and lifestyle, then this is going to make you it's going to make you more prone to not only digestive and health issues, but also mouth and dental issues as well. Now, researchers have found that advanced forms of gum disease are linked with other health problems: cardiovascular disease, stroke, bacterial pneumonia, high blood pressure, rheumatoid arthritis, dementia, Alzheimer's, and cancers like pancreatic and esophageal cancer as well. And it says to me that as a holistic dentist, our role goes beyond cleaning your teeth to treating infection, disease, and inflammation, and trying to rebalance the health of the mouth and the good environment for good bacteria. They're going to suppress these problems. So our role goes beyond, I'm just getting my teeth, they look yellow and stained. Our role is not about cleaning your teeth. The cleans that we do are to remove and break down bacterial buildup so that your gums don't become inflamed, unhealthy, and become open doors to allow bacteria to spread around your body. So pregnant women with gum disease may be at increased risk of delivering preterm or low-weight infants. So, it's like premature labour or tiny babies. That's been linked to problems with gum health. Bacteria and inflammation linked to gum disease, this spreads via the bloodstream and it travels around the body, adding to inflammation in the rest of the body. And we're now looking at, heart disease. We were always told it was cholesterol, but cholesterol is a response to inflammatory damage. So inflammation is what is causing a lot of our poor overall health and systemic diseases or conditions. So can you start to see, does this make sense? Can you see how important it is that you look after your teeth and gums, not just to have a nice smile, but to have a healthy body and a healthy life? And look, if you're, I get people who are clean living, healthy eating, they're into exercise, and they open their mouth and it is a train wreck. There is bleeding, swelling, there's inflammation, there's infection. And I say to them, hey, you've been doing all this work on your eating, your exercise, your products that you're using, you're avoiding environmental toxins and so forth, but this is a cesspit and this is making you sick. The good news is that in the majority of cases, we can treat it and we can get gum disease under control. We can repopulate the bacteria in the mouth. We can get inflammation under control and boost the immune system so that you do have a healthy mouth. But it has to be a team effort. It's not just we clean your teeth and you come back 2 years later and then expect that things are healthy. It's got to be ongoing care and ongoing home care as well. Diseases that you already have, such as diabetes, blood cell disorders, HIV, AIDS, other things that lower the body's resistance to infection, can make gum disease more severe and harder to treat and control. So severe problems in your body are going to cause problems in your mouth. So there's been studies that link chronic inflammation from gum disease with the development of cardiovascular problems. And mouth bacteria have been found in the blockages of the arteries. They've been linked to heart disease, blocked arteries. We've seen them in strokes. We see mouth bacteria in the brains of people who have Alzheimer's and dementia, for example. Now, if you have diabetes, and my gosh, diabetes, type 2 diabetes is through the roof. People with diabetes often have gum disease. Now, the irony here is that if you've got active, bleeding, infected, inflamed gums, that makes it harder for you to control your blood sugar levels. Now, when the blood sugar levels are out of control, that makes it harder to manage your gum health, because that blood sugar out of control increases inflammation and worsens and accelerates gum disease. So it's a bit of a chicken and egg scenario. And really, what comes first? Is it gum disease or the health condition? Or do they happen in tandem? Are they linked by being caused and worsened by inflammation? I don't think you can isolate one from the other, because if you've got inflammatory disease, as I said earlier, you have inflammation everywhere. So if your knee's inflamed, the byproducts of that inflammation, the C-reactive protein, that is spreading around your body and causing inflammation elsewhere. But with gum disease, you've not only got the inflammation byproducts, you've got the bacteria seeding out into the body and causing more inflammation elsewhere. So it makes sense that if we can control and halt the inflammation in your mouth, dentists, we can reduce inflammation in your whole body. And this is a fact that has been known for medical science for over 200 years. So let's talk about what can you do? What can you do in your life to prevent gum disease? Well, first of all, prevention and proper treatment of gum disease is important, because we've got to stop mouth bacteria from entering the blood and traveling to other parts of the body, as well as reduce inflammation. So yes, that's going to be dental visits and dental care to remove any plaque and tartar and allow the gums to heal. But there's some basic and universal advice that you can follow, and I'm sorry if this seems really simple, but what most people think is common knowledge and common sense, a lot of people don't know. So I'm going to go over the basics because I want to make sure we're all on the same page and nobody's getting left behind. So you need to brush your teeth thoroughly twice a day, and you need to spend more than 20 or 30 seconds doing it. To give your teeth a proper cleaning, it's going to take at least 2 to 3 minutes. So the reason we say 2 to 3 minutes is because that plaque, that film of bacteria that is building up and organizing itself into a very nasty, toxic, aggressive colony, needs to be disturbed and disrupted. And you can't do that in 20 to 30 seconds. You've got to brush each surface of your teeth about 8 to 10 times. So for 2 to 3 minutes, I want you to set a timer or get a decent power brush with an inbuilt timer program so that you know you're brushing for the right amount of time. I'm a really big fan of Philips Sonicare toothbrushes because they're not like an electric toothbrush that turns around, like I'll turn this way, turns around like this. They vibrate. And that vibration, that sonic vibration, not only mechanically cleans the teeth, but the sonic actually breaks down and explodes nasty bacteria. And that's what we're doing in the dental practice with that very high-pitched machine that a lot of you don't like because it's noisy and it can be a bit sensitive. But on that, the healthier your gums are, the more comfortable having your dental treatments are. So there's another win-win. So the basics are brush 2 to 3 minutes twice a day. You also need to clean in between your teeth. And I saw a great little cartoon the other day, and I'm going to be crass. If you don't floss your teeth, it's like wiping your butt cheeks after you've gone to the toilet and not doing the crack down the middle. Sorry, I know that's graphic. What I tend to say is it's like having a shower and not washing your armpits, but it gives you the understanding of what's going on. So if you don't clean between your teeth, there's about 40% of your tooth structure that's dirty. And that puts you at risk of tooth decay, but it's leaving food and plaque and bits and pieces in between the teeth that are going to aggravate and inflame your gums. So I want you to clean in between your teeth with floss or one of those little interdental cleaners, like a little tiny bottle brush, and do that at least once a day. I want you to use a good, healthy, gentle, antimicrobial mouth rinse that's designed to reduce harmful bacteria. So I'm not talking about that one that makes your mouth explode. I'm not talking about ones that have alcohol in. I'm talking about one that's well balanced, got essential oils and a lot of natural products in. Because we don't want to wipe out all the bacteria in your mouth. We only want to reduce the harmful ones, but we also want that product to reduce inflammation. So we actually want an anti-inflammatory component to your mouthwash rather than an antibacterial. Because if you kill all the bacteria in there, what happens is the nasty ones have nothing to stop them breeding, and they will accelerate and cause more problems and more inflammation. If your mouthwash has got alcohol in, it's going to dry out your mouth. Having less saliva means you're more at risk of gum disease and tooth decay, but also alcohol in mouthwashes has been shown to cause precancerous and cancerous changes and end up with oral cancer. So if it's got alcohol in, guys, ditch it. Use it as toilet cleaner. Sorry, Listerine. Oh, no, I didn't say the name. I want you to eat a balanced diet. Now, everyone tells me they eat well, they eat a balanced diet, and really I don't think anyone really knows what that is because there's so much confusion when it comes to dietary advice. So I talk about eating real food, and that means non-processed foods that don't come out of packets. I'm talking meat, fish, eggs, chicken, vegetables, and some fruit. That's the sort of food that our bodies are designed to eat. It's what nature had in mind when she said, okay, you need to eat to be able to get through your day. I do love having you all on here because I don't get time when I'm in a consultation with a patient to share this volume of information with them. I want to empower people to make better choices, to understand their dental health and know what it is that they need to do at home and not just give up and think that, you know, their life's over because they've got some mouth problems that the dentist always seems to pick up. So we're big on prevention as well as treatment. So we've talked about brushing twice a day, flossing or cleaning in between your teeth, using an anti-inflammatory mouthwash, and also good diet. Don't smoke. Real simple, don't smoke. Smoking is one of the worst things you can do for your health. You don't need me to tell you that, but it is the biggest causative factor for accelerated gum disease and gum problems. Now, the issue is when you smoke, it reduces the blood flow and the oxygenation to the mouth. That allows more bacteria to breed. It suppresses your immune response. And what happens is because of that lack of blood supply to the gum tissue, you actually hardly ever get bleeding gums. Yet when we go around and we have a look, your gums have peeled away from your teeth and the bone has been damaged and it's all too late. So if you do smoke, I understand. Try cutting back, try quitting, speak to your GP. Let's get you on, road to better health. I also want you to schedule regular dental checkups and professional dental hygiene appointments. And this is where we remove the buildup of plaque and tartar and bacteria from not only on your teeth and around your teeth, but under your gums as well to reduce inflammation and help halt the progress of gum disease and put advanced gum disease into remission. Now, when you brush and floss, that's like washing your hands, but you still have dirt under your fingernails. Now, our job is to come and help you improve your hand washing, but also to get in under the fingernails and remove what you could not get to. And that's why those regular cleans are so important. It's like you clean your kitchen, but you can't get in behind the fridge to clean it out. Now, our job is to pull the fridge out and get in behind it and clean everything up. I hope that makes sense. So we can do all our things within the dental office, but you have to play your role. You've got to take great care of your mouth, your gums, and your overall health and well-being. So what is it that you should be looking out for? How do you know if your mouth's healthy or not healthy? Well, some people go, well, it's not painful. It must be okay. Well, like heart disease, it's not painful until you have a heart attack. Gum disease and a lot of mouth problems are chronic, and so you don't get obvious pain with them. Like heart disease, unless you have the heart attack or it's picked up in diagnostic tests that you have a problem, a lot of gum and dental conditions would go completely unnoticed. Now, I tell you honestly, if gum disease was painful, our phone would never stop ringing, our practice would be open 24/7, and we would still have a queue of people down the street because we would not be able to service them. Because as human beings, we go, something's painful, I want it not to be painful, so go get it fixed. Problem with gum disease, not painful, so you are oblivious. And when we tell you have gum disease, half the time you don't believe us. And that's where our problem lies. But there are some warning signs. And just because these things might happen commonly or they happen often doesn't mean that it's normal and that it's okay. So if you notice any of these signs, it's highly likely that you have gum disease. And you need to be aware that these symptoms can also be a sign of poor health, not just in your mouth, but your whole body. So I don't want you to ignore them or think that it's normal. It's certainly not normal to have blood in the sink when you spit out. Do not ignore that. So, do you have gums that bleed during brushing and flossing? Do you have red, swollen or tender gums? Have you got gums that have pulled away from your teeth or receded? Do you have persistent bad breath? Have you noticed discharge or pus coming out from between your teeth and gums? I hope if you'd noticed that, you would go and get them checked. Do you have teeth that are loose or moving, separating, twisting, gapping? Have you had a change in the way your teeth fit together when you bite? Have your teeth moved or drifted? Have you got receding gums? Have you got a bad taste in your mouth? If you've got any of these symptoms or if you noticed any changes, it's time to seek dental advice and treatment before it's too late. So I urge you to give your dentist or give us a call. Don't put it off. These things can be really serious. I mean, these signs are not only a sign of things like gum disease, but it can be a sign of mouth cancer. It can be a sign of diabetes. It can be a sign of heart disease or leukemia or severe nutritional deficiencies, HIV, and so forth. So please don't think that because you've got a little bit of blood coming out when you brush and floss, it's okay. If every time you washed your hands, blood dripped out from your fingernails, I think you'd be very concerned and you'd want to be going down to your doctors and going, doctor, make this stop. So we need to take that same approach to what's going on in here. This is part of your body, and if you're sick in your mouth, you are going to be sick everywhere. Your teeth and gums are going to be making you sick. Gum disease, it's not just about brushing and flossing. Gum disease is what we call multifactorial. That means it's caused by many things and it is influenced by your diet, your lifestyle, and changes in your health, medications that you're on, the quality of your sleep, what your hormones are doing, your nutrition, and your stress levels. This all plays a major part in how healthy your gums are. So when we assess your gums, we also want to know what's going on for you from a health and lifestyle perspective. So often when you come to the dentist, we're going to ask you, is there anything going on with your health? And it's important to tell the dentist or the hygienist about any changes in your overall health, any recent illnesses, any chronic conditions, changes in medications. We want to know if you're on any prescription meds or over-the-counter products, any supplements or that sort of thing. Has there been alterations in your life or your work circumstances? Has your sleep changed? All these things can be impacting on your dental health. And by giving us that information and answering those questions and not thinking that we're just being busybodies and nosy and going, oh my God, they're only looking at my teeth. Why are they asking me that? We ask you that because we care about your systemic health and well-being. This way, when we get the answers, we can piece together what your mouth is showing us with what you're telling us. And from there, we can prescribe the best treatment for your dental health and for you. And it might be that the best treatment is for you to go and get a blood test or have a visit with your doctor. Who knows? Look, a healthy body starts with a healthy mouth. Gums should not bleed, they should not be swollen or be red. These are signs of bacterial infection and inflammation that are going to be damaging the health of your gums and your body. So what other things can you do to support your gum health and prevent gum disease or put a health into its progress? Well, number one is get your dental checkup, get any dental hygiene issues dealt with, get that build-up of harmful plaque bacteria and damaging tartar, get that removed from around your teeth and gums. This is going to quickly help to reduce any inflammation and start to switch off the active disease processes. Now, depending on the severity of your gum health, this may be as simple as 1 or 2 visits with a hygienist, or you may need a prolonged and intensive course of what we call gum therapy, and this is done over a series of visits. And it's usually done a quarter of your mouth at a time. We numb everything up and we go in deep under the gum line and we thoroughly remove the buildup and treat the infection in your gums. Number 2 and number 3 is to address your diet and your lifestyle factors. So you've got to look at if there's poor nutrition, poor oral care, stress, smoking, alcohol consumption, exposure to toxins, lack of sleep. These are all going to lead to, cause and accelerate dental disease. So if we can address those lifestyle factors, we're going to have a much better outcome. So to recap, and maybe just take this a little bit further, one of the most common infectious, now I'm going to emphasize infectious, diseases known to the modern world is gum disease. Yes, gum disease is contagious. It's passed from one person to another as that mouth bacteria goes from you to your partner, to your kids, to your grandkids. If you have gum disease and so does your partner, you get your mouth treated and your partner doesn't, they will reinfect you with their mouth bacteria and put you at risk of gum disease again. So you both need to get treated. If you have gum disease and you've got young children or babies, grandkiddies, please don't go kissing them on the mouth. Don't go sucking on a dummy and putting it in their mouth for them. Don't blow and lick their food or anything like that. You do not want anything that's in your mouth inoculating that child and passing gum disease from you to them. Okay, I hope that's made that point very clear. Gum disease affects over 4 billion people worldwide. We have 7 billion people on the planet. 4 billion have what's called periodontal disease, which is the severe form of gum disease where not only has there been bleeding, but the gums are peeling away and there's bone loss. This is an often ignored health problem, and it's directly linked to increased risk of cardiovascular disease, arthritis, diabetes, dementia, and cancers. I know I am repeating myself, but I need you to know this. I want it to sink in that those bleeding gums are a sign of ill health. By simply changing your diet and your lifestyle habits, you hold the key to reversing one of the major threats to your health. You have the power through changing your diet and your lifestyle habits. You have the key to reversing the damage from gum disease. You are going to make such a major difference to your health if you address this. Now, our modern diet is one of the major reasons we have such an increase in not only chronic diseases, but gum disease. And I'm seeing gum disease, severe gum disease, in younger and younger patients. Recently, I've seen patients in their 20s with advanced gum disease and bone damage around their teeth. They've got inflamed gums and they've got infection. And what I put this down to is poor diet and poor lifestyle. Tooth decay was nowhere near as prevalent as it is today in our ancestors. We've adopted a carbohydrate-rich diet. We've got industrially processed flour and sugar, and this has caused and is still responsible for an explosion in the incidence of tooth decay and gum disease. Increased consumption of grains and cereals has created a marked increase in dental tartar, which is called calculus, and plaque bacteria. while free sugars in syrups, juices, sodas and concentrates produce acid that cause tooth decay, and this is a double whammy of tooth-destroying food choices. So if we're just telling you brush and floss, is that enough as a dental profession? I say no, it is not. We need to be able to give our patients nutritional counselling. Now, the problem is, during dental school, we get an hour's lecture on nutrition and dental disease, which is basically talking about sugar, 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 and hidden sugars. We don't get told how to educate our patients how to eat nutritionally so that they get all the vitamins and minerals and antioxidants that they need to support strong bone, gum, and teeth health, but also to support and boost their immune system and reduce inflammation. And things like hydrogen peroxide, coconut oil, essential oils as well are really, really good for your gum health. But you must do that in conjunction with removing the plaque and tartar buildup, particularly the stuff that's under the gum line, which is wreaking havoc. Because once it's under the gum line, it's in an area where there's not a lot of oxygen, and that means nasty anaerobic bacteria, which are more likely to cause disease, are allowed to breed and grow. And so even with if you've got deep pocketing or gaps where there's bone loss, those topical agents are only going to do so much. We have to treat this as a systemic disease and treat it from within. We have to address any areas of our life where we're not taking the best care of ourselves. So too many people are unaware of, and they remain just completely uninformed about the best ways to care for their mouth. So that's increasing the risk of disease. So again, bottom line, poor nutrition, toxicity and chronic inflammation triggered by poor oral health puts our lives at risk, and all of this is unavoidable. So I'm going to say again, let's eat real food, unrefined, unprocessed, whole, natural foods. These foods, by their very nature, are nutrient dense and anti-inflammatory. And these are two important factors when it comes to maintaining your dental health and your body health. Now, did you know not all bacteria in your mouth or dental plaque are bad? Your mouth has over 6 billion bacteria, and the majority of these I would call healthy dental plaque or good bacteria. And these healthy good bacteria support you to have a healthy mouth environment and defend and stop the bad bacteria from overgrowing and causing harm, the harm that's going to lead to inflammation and disease. But if you don't feed those good bacteria and yourself the right foods, bad bacteria will take over. Using those harsh, explode in your mouth mouthwashes damage your healthy bacteria, and that leaves an environment where the bad bacteria can grow unchecked, as there's not enough good bacteria left to keep them under control. Those healthy dental plaque bacteria fight the disease-causing bacteria. They also help remineralize teeth to prevent tooth decay and help stabilize any acid levels, so they need to be looked after and cared for properly. However, if you've got inflammation, that will and can upset the delicate balance, as can poor food choices and poor oral hygiene habits. So bacteria in the mouth should not be killed, but fed properly to encourage the growth of the beneficial microorganisms. This is because the good mouth bacteria produce hydrogen peroxide, a natural antibacterial that keeps the harmful bacteria under control. Now, you heard me earlier talking about anaerobes and how they survive in areas where there's no oxygen. Well, hydrogen peroxide, when it's released, bubbles. And the bubbles are bubbles of oxygen gas, and that suppresses and kills off those nasty bacteria. So to decrease the harmful growth, the harmful growth of nasty bacteria in the mouth and promote the good bacteria, eat healthy amounts of prebiotic foods. And these prebiotic foods are things like garlic, onions, avocado, apples, and asparagus. And also at the same time, avoid processed refined sugar, junk food, and soft drinks. I see many people who are trying to be healthy, they're trying to get fit, they're trying to overcome health conditions, and they want to take better care of themselves, yet so often they neglect the element of having a healthy body, and that's having a healthy mouth too. And just as I said earlier, because you're not in pain and your teeth don't hurt or your gums aren't sore, it doesn't mean everything is okay. Bleeding, red gums, bad breath, obvious buildup on your teeth, sensitivity, tooth movement, or any changes in your bite, these are all signs that something is not right. You can have gum disease and not even know it, just the same as when your arteries are blocking up before you have a heart attack. Don't ignore the warning signs. Don't avoid having dental checks, because not only could these things save your teeth, they can also save your life. Your mouth can be the source of inflammation, infection, and toxicity to the rest of your body, which stresses your immune system, creates more inflammation, and puts you at risk of a serious life-threatening disease. My role as your dentist is to be part of your healthcare team and to help you to keep a beautiful, healthy smile and have a healthy, long life. And this is why our strapline is Evolve Dental Healing, fill years, not teeth. It's time for you to start listening to what your mouth is trying to tell you. Stop ignoring those warning signs that you could have gum disease and inflammation. Make some simple changes to your diet and lifestyle and get your gums professionally checked and treated. This is going to go a long way to preventing and reducing your risk for serious illness and disease. I hope you found some value in this. I hope you've enjoyed it. I hope you've took some things away that you can go, aha, I didn't know that, and you can put some things into practice.
Thank you so much for joining me. Thank you for listening to the Dental Zone podcast. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. My practice is called Evolve Dental Healing. Our number is 0737 20 1811. You can call to book for a consultation, or you can email us info@holisticdentistry.au. And until next time, thank you so much once again. Stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.